The St. Kitts and Nevis Health Services Sector ICT project was officially turned over to the Ministry of Health on Wednesday, June 5th, at a ceremony held at the JNF General Hospital Conference Room. The project comprises a system which consists of state-of-the-art cutting-edge telecommunication equipment, specially to be used within the health sector on St. Kitts. This provides for health institutions in St. Kitts to communicate more seamlessly, allowing health professionals to share medical records and for patients to receive attention from medical professionals within the public health care system, virtually through a built-in video conferencing system. Prime Minister and Minister of Health Dr. Terence Drew explained the importance of having such a system in place to improve the delivery of health care to citizens and residents.
You have a patient come to you who would have been seen in the hospital the day before, the night before, and you ask that patient, what did the doctor do? Well, they give me some drips and they give me a white tablet and a pink tablet, and this is what patient says to doctors. And the doctor is there, really, what is this white tablet and this pink tablet? Sometimes they might call the hospital, did you see that patient? We have to get the chart. Okay, the chart has already been filed, let's get over the medical records, send it to our doctor, yes. All of that, almost a whole day is passed. Definitely the time you are seeing the patient in would have already passed. And that patient probably would have left the office, not with optimal care, not because it's the fault of the doctor, but how can a doctor deliver optimal care when he or she does not know exactly what was given to the patient the night before?
The project was funded by the Universal Service Fund under the auspices of the National Telecommunications Regulatory Commission, the NTRC. CEO of the Universal Service Fund, Irvin Williams, explained how the project commenced.
But I must say, Honorable Prime Minister, that when you, in March of 2023, requested an audience with the NTRC, I had no idea what to expect. But I had the privilege on behalf of the staff and board of commissioners of the NTRC to attend that March meeting with you, and so I did. And it was, Mr. Prime Minister, when you raised the discussion of designing and implementing a high-speed, cutting-edge, state-of-the-art network to modernize the healthcare sector on the island. You looked across the table from where we sat in March 2023, and you asked if this healthcare network is something that can fit within the scope of a regulatory framework. The short answer was yes, but there are strict guidelines that must be adhered to, but it was doable. So here we are today, after what I would call some serious heavy lifting, and after, I'm going to add, stressing out Pat and her crew. But it was all worth it, I must add.
Wesley Wharton, acting chairman of NTRC, spoke of the collaboration between the Ministry of Health and the NTRC on this project.
The projects coming out of the USF Fund, as you can see, oversight of your program includes the Government of St. Kitts and Nevis Education Network, the internet access to the Nevis Community Centers, internet access with VoIP services to the New Horizon Rehabilitation Center, COVID-19 enabling virtual education. And Mr. Williams, I remember us acting very quickly on this. So whereas some projects may take time, we can actually move very quickly.
Meanwhile, at Wednesday's launch, a demonstration of how the system works was presented to the attendees, which included board members, management and staff of the cable. Here, a patient at the health center in Keon is attended to by a nurse at the center and a doctor at the JNF hospital in Bastyr via video conferencing. This was done in real time on Wednesday.
I minister can give me a call with a manual blood pressure check, okay? I advise the patient as well that it's very important for her to take her medication regularly.
Conferencing. So we use Google so you can see, but this is not Google's or Teams or anything. This is the system doing it. Instant specialist access, and we could hook in more than one specialist onto the platform. Yes. So if it's hypertension, it's probably a stroke, somebody else could come in, yes, and they can kind of diagnose together. Yes. Enhanced patient care, accurate, timely intervention.
At the end of the ceremony, the cable was presented with a 70% funding for the project. This will cover the cost of the internet infrastructure for the project, which is provided by the cable. Also present at Wednesday's ceremony were other public health officials and the ambassador of the Republic of China, Taiwan, Michael Lin. Taiwan was also instrumental in helping the execution of the project. I'm Andre Huey for SKN Newsline.